Heart rate and progression tracking of atrial fibrillation. Atrial fibrillation is progressive, meaning it is likely to worsen over time. Paroxysmal or intermittent atrial fibrillation can turn into persistent, and persistent can worsen over time, becoming long-standing and potentially permanent. It is therefore important to keep track of your health and heart rate to identify progression or development early on. There are two methods of monitoring your heart rate at home. One option is to check your pulse, either manually or using a device such as a pulse watch or pulse strap. A more precise and informative method is to capture an electrocardiogram, often referred to as an ECG. You can do this using a device such as a smartwatch or a fitness watch capable of producing an ECG scan, or go for a dedicated ECG monitor. A smartwatch can provide a long range of features that might make them the favorable option. But keep in mind that these devices vary greatly in precision, and only a few of them can actually produce electrocardiograms, ECG. While these devices cannot produce an ECG of professional quality, they provide great value due to the fact that they enable you to track your heart rate on your own, or even at all times in case you choose to go for a worn device such as a smart or a fitness watch. Another option is to manually check your pulse. To measure your resting pulse, you should be relaxed, seated, and avoid drinking coffee or smoking at least 5 minutes before checking your pulse. When you are ready and feel relaxed, put one of your hands out so you're looking at your palm. Use the first finger, your index finger, and middle finger of your other hand and place the pads of these fingers on the inside of your wrist, at the base of your thumb. If you have a hand watch, it is a good idea to use that hand to measure your pulse, as this will allow you to look at the time while you are measuring your pulse. Press lightly and feel the pulse. If you can't feel anything, press slightly harder. Once you have found your pulse, try to feel it for about 30 seconds in an attempt to measure if it is regular or irregular. Next, you should measure your pulse rate, your so-called beats per minute or BPM. You do this by counting the number of beats in your pulse for 30 seconds. After the 30 seconds has passed, multiply the number of beats by 2 so that you get your BPM, your beats per minute. A regular resting pulse can lie anywhere between 60 to 100 per minute and will be regular, meaning the beats follow a steady rhythm. However, well-trained adults may have a normal resting pulse as low as 40 beats per minute. When should you seek advice and help? If your heart rate is faster than 100 beats per minute after resting for 5 minutes, especially if at the time you do not feel comfortable. If your heart rate is slower than 40 beats per minute, especially if you are not feeling well, for example, feeling dizzy or maybe on the verge of fainting. If your heart rate feels irregular, your pulse is not beating at regular intervals, but instead more or less randomly, regardless of whether you otherwise feel comfortable or not. These can all be signs of atrial fibrillation, particularly an irregular heartbeat. If you have atrial fibrillation, it is important that your doctor, together with you, decides whether you need blood-thinning medication to prevent the formation of blood clots in the heart being able to flow out into the body and settle as harmful blood clots in the brain or in other organs. You can read more about atrial fibrillation and the heart on rhythmadoctor.com.